Clinical Conversations on today's Smart Chiropractor show. We are going to revisit another one of our Axis 2021 presentations. Axis was our clinical conference that took place online earlier in 2021. Be on the lookout for details on Axis 2022 coming soon. And we wanted to revisit a really important topic, especially for you business builders and entrepreneurial chiropractors out there. And this is about scaling multi-unit locations. 5-10 years ago, if you met a doc who had 3 or 4 practices, that would have been an anomaly. Now we are seeing large groups, dozens and dozens of practices start to take shape and take form. Sometimes that's executed through a franchise model. Sometimes it could be on varying business structures, but it's not uncommon to see docs scaling multi-unit locations today. Certainly it's much more common than it was even just a few short years ago. So we had one of the experts, a gentleman who has done this time and time again, come on and offer some insights into what he has seen successfully scaling multi-unit locations. Let's take a peek into the conversation that we had with Sam Wang, an Axis 2021.
We're going to go right into the meat of this and talk about the first mistake. And a lot of times the error is that people think, 1 + 1 = 2. And if you've ever been a parent or you're currently in it deep raising children, the first child was the experience that you had. But then as soon as you add another child into the mix, it wasn't just a replication of child 1, right? Because you have that second dynamic called, well, I still have child 1 and now I'm bringing in child 2. And so a lot of people just think, well, I just have to reproduce what I just did with the first experience of the first practice. And that's not always the case. And most of the time it isn't the case. And what I really found is many, many doctors, as we get excited about wearing the entrepreneurial hat, dive into clinic number 2 prematurely, meaning they haven't truly and consistently reproduced success in clinic 1 before they ended up going to clinic 2, 3, or 4. And that just then accelerates the pain points of navigating through operating a business even faster. But the challenge is then your risk of the expense, right, and the cost to start those and to then manage and staff those businesses becomes overwhelming and eventually leads to a demise of the business. And that has nothing to do with, again, the clinical aspects of that provider, right? And so what we're going to hit here with 1 + 1 = 2, the fact that what made you successful at one location definitely is not going to be enough to make you successful in the next. And predominantly that's going to be because what I found through researching successful chiropractors, especially doctors out there that promote that they're doing well in whatever type of practice and business that they operate, it's usually a one-man show. They are wearing multiple hats, and they have that bandwidth to be able to do it. They have the energy to do it. They have the intelligence to do it, and then they lead their teams into a successful business, right? And then when they open clinic 2 or business number 2, they think, I just have to do those same things and stretch more. But again, as I mentioned earlier, as we're all limited to those 24 hours of the day, you could for sure decide to minimize the amount of time that you take off or sleep. But at the end of the day, we there's only so much bandwidth. And I noticed that people then use and rely on their individual talents as opposed to what we just shared earlier, creating systems, creating true replicatable systems so that it's not reliant upon talent of the individual doctor, that it's now focused on team and the management of the organization, right? Part of the systems that we've gone through to standardize is the training, right? So again, the first thing you do to scale is to then reproduce yourself. And in doing so, you need another strong clinical provider, right? That is then clear on what it is that they're learning. And so if you don't have a defined clinical system that you're adhering to outside of what's inside your brain, and it's not written down, that's step one, that you're going to have to make sure that there is a clinical system. There are a lot of great references out there in terms of guidelines, musculoskeletal guidelines that you could use. Most institutions, sometime while you were a student, had a clinical manual that you could follow. And most state associations offer toolkits to follow as well regarding how you're going to document, how you define short, long-term goals, and then most importantly, how you're going to measure those patient outcomes, right, to really generate the success overall. And so we created in Chiro One an actual fellowship training program because, again, inherently, it's not out there, it's hard to find, and unless you know where you're looking for it, we wanted to make sure every provider coming through our organization got the same introduction and the same information to then be able to reproduce the same clinical outcomes that we told how great our patients love our doctors and our practices. So we went through a 12-week fellowship program that consists of clear and precise office procedures and protocols, because I think the best value prop besides getting patients out of pain and improving function is we're there, we listen, we like to be a part of our patients' lives. And so when you look back at net promoter scores or customer service satisfaction surveys out there, patients always say, my chiropractor spends more time with me, right? And many times that isn't necessarily a quantitative, it's more of a qualitative value that then they go, oh, I didn't realize it. It felt like it was, 10 minutes or 15 minutes, even though it was a 2-minute conversation. But reproducing and training how to have those conversations are really, really important. And then most importantly, where the support staff, your CAs and CTs, add into that value because they are the extension of you, the provider. And you want to make sure that, again, they know where to go and where to be and the conversations to have that you would have personally and be able to reproduce that again. And then talking about those outcomes, are you following a standardized treatment recommendation program? If the same patient or the same case with the same condition came into your practice today, as opposed to 6 months from now, would you prescribe the same frequency and duration of care for that patient? Would you recommend the same services? And notoriously as an industry, we just have this reputation that if you visit 10 chiropractors, you're going to have 10 completely different experiences, right? And so that consistency around managing your patients' cases and following a set of guidelines is going to be important, not just for you, but also then for the additional providers that you bring onto your team, including when you then scale to multi-units, multiple locations, that everybody is following that same protocol, right? And then lastly, all the things that we learned through trial and error, through years and years of practice experience, the professional development of learning what to say, how to say it more efficiently, so that then you optimize that conversation as opposed to taking 2 hours to convey a single message, right? And so we spend the last 30 days focused on how do we improve the communication or the public speaking aspects so that when you do your reported findings or you do your group lectures, that patients get that aha moment as opposed to, doctor, that was great information, right? They just know you're smart. And that's not the outcome we want coming out of that. So we've standardized the clinical model through a fellowship training program. We also understood that even hiring, because again, this isn't a job that we're ever trained in chiro school, how to go through and pick the staff that supports, right, the team in that practice. Where are the weak points and how to identify hiring somebody to fill in those weak points so that the team is stronger, and creating a model that you can reproduce over and over again, which was really, really important. Definitely investing and focusing on hardware as well as software, right? FF&E is what we call it, fixtures, furniture, and equipment, right? To support the level of care that you want to provide. And so you have to make sure that whatever you decide to purchase for Office 1, that you then duplicate for Office 2, as opposed to the second office. Many times I've seen in a new chiropractor or a new entrepreneur's business, as the kind of stepchild, right, syndrome, that they get everything used or they get kind of piecemeal ad hoc equipment until that office achieves a certain volume of success. And I would say start it the other way around. Be consistent with how you manage, right? Practice development, performance is the underlying, it's part of the three-legged stool in our industry, right? From marketing and patient acquisition to revenue cycle management to then practice management. In our business kind of entrepreneurial world. And so you have to be sensitive to not all providers and not all staff members relate or resonate to different styles of management, and to be aware of what style you possess, right? And then also the styles of learning that your staff and your additional support providers have, to be able to mirror them appropriately is crucial. And I think it's a really key success formula for that. And then, as really, really important, I think a lot of chiropractors bypass this because we know just through anecdotal, subjective, conversations we have with our patients that patients are getting well. But as chiropractors and as an industry wide, we have to demonstrate the measurement of those, right?
All right. Great conversation from Axis 2021 with Sam Wang. This is a gentleman who has grown and scaled multi-unit locations to a level that very few have in the chiropractic profession. A lot of great take-home messages there. And the number one aspect to me is really understanding before you go that direction. Are you going to be able to commit? Do you have the skills, tools, and support necessary to make it happen? Because as he said, and I agree with, there are many chiropractors out there that have a successful single location practice, open up a second, and next thing you know, they're draining profits. They're just not able to get over the hump on that second location, because you have to have systems and processes dialed in. You have to really come in with a business acumen and understanding that is a little different than having a single location practice. So understanding who you are, understanding what your goals are, critically important. And just because you're successful on one location doesn't mean you're automatically successful in another. But for those docs that do have the interest, it is an opportunity in an area of growth in chiropractic that is more rapid than ever before. Jason, what were your take-home messages?
I could go on a really long time. Sam's a great guy, and I consider him a friend. And I think you mentioned like no other. I do believe it's accurate to say that what they have built, Sam and his team of other chiropractors, what they built is, I believe, the largest chiropractic practice on the planet. It's owned by one company. I believe they are over 100 locations now, both in terms of practices they've started as well as now acquiring. Stu Bernstein and the whole team behind it is just phenomenal. But the key thing I want to mention is everything you said is right and true, and it starts with mindset. We opened the show with mindset. This is another example of mindset. And if you're a chiropractor that thinks like a chiropractor, as in a technician, as in someone with a specialized skill who helps people get well, that is a different mindset than someone who thinks like an empire builder, someone who understands how to attract other chiropractors and give them the right opportunity and build staff and teams and be able to present collectively the message of your practices locally and globally. That's what they do. It is a Herculean effort, and kudos to them for making it happen and for sharing the knowledge with others who also want to sort of follow in their footsteps. They're just generous. They've got, all the right intentions in what they're doing. And I continually root for their success and hope others see what they've done and go, I can do that too, and are willing to take the scars, do the work. It is not all easy breezy and success. There is a lot of, it's choose your own adventure, and it is quite the adventure. So great to see the opportunities in our profession to be able to grow, to be able to scale, to be able to make a massive impact in the hundreds of millions of dollars, maybe billions of dollars at some point. It's a wonderful thing to see. And thanks, Sam, for giving us your time.
Indeed. Thank you, Sam, for coming on for Axis 2021. And if you are listening and watching right now, be sure to stay tuned for details on Axis 2022. Over the next few weeks, we're going to continue to revisit some of those standout talks from 2021. Hey, if you like that video, be sure to subscribe to The Smart Chiropractor. We are posting videos on how you can market your chiropractic practice in a way that teach and invites consistently. We have found that is the magic formula to big time growth. So if you like this video, be sure to comment down below, smash that subscribe button, or visit us at thesmartchiropractor.com.